Having been incarcerated, there is no location in prison to separate the sick.
Protection that people do with the coronavirus, like the 3 easy things that people could do, right? So you wear a mask, you keep socially distanced, which means that you try to sort of keep, like 2 big arms width away from everybody, right? And that you frequently wash your hands. The regular things that, the non-incarcerated population can do are things that you may not have the option to do. And, that's some of what, makes this especially worrisome.
They can try all they can to social distance and put masks on, but how much can you really do when you're confined in one little room, one little zone? There's just no way to really properly social distance in a controlled environment like that.
All of those layers of protections that we put in place are not available. If you can't spread out from other people, you've lost one of those layers of protection. If you can't wear a mask at all times, you've lost a layer of protection. If you don't have the opportunity to wash your hands regularly, you've lost a layer of that protection. With the addition of the vaccine, we can make up for the fact that some of those layers aren't possible in all environments. My name is Jason Parham. I was trained to detect and prevent and treat all types of infections. That includes things like influenza, malaria, pneumonia, and including things like the coronavirus. Compared to flu, you're much more likely to die from infection with the new coronavirus during this pandemic. It is much more lethal than our usual circulating flu strains, and the likelihood that you're going to have a bad outcome is much, much higher than your likelihood of having a bad outcome with the flu or an ordinary cold.
What makes coronavirus different than other seasonal viruses that we're used to, like the flu virus, is that it's a virus that learned a new trick. I think all of us have, experienced at one point in our life a flu virus where we feel knocked out for 10 to 12 days and, slowly get better. But, what we're seeing with coronavirus is that it can impact, your body's health for, the rest of your life. And I think that's something that's very different about, coronavirus.
I want to be honest. I took this virus lightly before I caught it. Okay? And when it hit my wife and I so hard, we do not downplay it anymore. Me and my wife and my daughter had it about a month ago, and it almost killed me and my wife, and my daughter was running around like she was on vacation from school. It didn't even affect her.
One thing we worry about with coronavirus is, there are people who will have mild symptoms, your fever, your cough. But then there's a whole other group of people, and you can't tell who these people are going to be, who end up with blood clots that can cause strokes, that can cause pulmonary embolus that make your lungs stop working. There are also people whose lungs fill up with phlegm and fluid to where they can't breathe. And even people who seem to recover from the virus, but 2 or 3 months later end up having heart failure.
So even young adults are at risk of contracting the coronavirus. In fact, they're at some of the highest risk of contracting the coronavirus. And they're also at risk of developing serious disease.
So just because the disease might not affect one person drastically does not mean that that same strand won't kill the person next to you. I think that's the most important part of this, man.
We've all heard of the golden rule, to do unto others as you would others do unto you. And if saving a life is as simple as getting a vaccine, then you have saved a life, or even saved your own life or own family's life, or whatever person you may come in contact with. It is a unseen virus. We cannot predict who's the carrier, where it's dormant, or where other variants of it may find a harboring ground to grow or to mutate. And we wouldn't want to be one of those ones who are a carrier that allows it to be continuous.
They don't separate the inmates, right? You got the older population right there with the younger population. And although one person might get this virus and just get headaches or just lose taste and smell, the person next to them can get the exact same virus and die from it. So vaccination is the only way to stop it from spreading, because once it gets in there, it's in there. So vaccination is the only answer to that.
I understand the fear, the hesitation, and the reservations you have about getting the vaccine. African Americans are skeptical because of the Tuskegee experiment and just the lack of trust.
For everybody that's still skeptical about taking the vaccination, I understand that there are challenges within the system when it comes to getting medical help and all that, right? I've been there, I've done that. But I would beg you to just listen to the medical advisors that are actually running things out in this world.
So there is no special vaccine for people in prison. It is the same one that, my own family got.
Everyone that's been vaccinated thus far in Mississippi and in the United States has received one of the first 2 vaccines that have been approved for use thus far in the United States. We've used them both with our physicians and with our patients. These will be the same types of vaccines that will be used inside the Department of Corrections.
From the people that I've talked to, the concerns that they have about the vaccinations is not enough study. They feel like it was rolled out too fast. Some people are even making it political. So it's just people are scaring people about the vaccine is what it boils down to me.
There's nothing in the vaccine to be afraid of. There is nothing in the vaccine that causes you to become sterile. There's nothing in the vaccine that prevents people from getting pregnant in the future, should they so desire. There's nothing in the vaccine that can change your actual DNA structure and is never incorporated into your genetic material at all.
That technology is different now. We are more on the cutting edge of getting the correct information and getting that information faster.
I can get why people feel nervous about the vaccine, right? Like, you hear so much talk, but the coronavirus vaccines are totally different, right? The reason why they were able to be, made so quickly is because of all of the new technology that's come within the last 20 years, right? So billions and billions of dollars went into doing the science for this. Like, the science had been slowly kind of progressing over the years, but then it was like the moon launch, right? They said, we need to get this done in 1 year, right? And all over the world this happened. So it was like a whole global moon launch to get this done, right? Other vaccines are from, dead viruses, right? But this is a piece of a virus that your own immune system responds to and learns how to make, the antibodies to fight the virus.
And it's just a little tiny piece that can then fool your body into thinking it's seen the coronavirus and allow your body to make a defense to prepare it to battle a true infection. So you're not seeing any part of the virus inside the vaccine. The vaccine cannot give you the infection at all.
We think about a vaccine as, your immune system going to school or getting an education, right? This is like the walk to school that your body has to take, and it makes you a little bit tired, right? You may have a mild fever, right? But your body's working hard. It's trying to learn a new skill. It's trying to learn a new thing, right? You may have a little period where you feel kind of your arm is sore. I mean, that's the symptom I had, is my arm was sore. It felt like I had been doing a bunch of these kind of, workout, sort of moves. I'd been really using my deltoids a lot for something. But, those symptoms usually go away within 24 to 48 hours.
But when it comes to this vaccination, once again, I just fall back on, do I want my family and friends to catch this virus? Do I want my wife, my mother, my father, my daughter, my whoever that is coming to visit me on visitation day? Do I want to risk giving the people that I love more than anything in this world a disease that could possibly kill them?
Being on the inside of prison, visitation is important. And if you don't want to go to video visitation and you want that touch, being vaccinated gives you the argument to be able to get that touch. Virtual is not fun. We all want a hug. We need hug. We need embracing. And the more of us get vaccinated, the more of us can go back to being able to embrace one another, to just take that shoulder and cry on it.
I can only imagine the stress it must cause for families who are separated from their loved ones, who are incarcerated. I think a lot about that family separation and what it feels like. And I guess just to talk a little bit about my personal story, with the coronavirus is this summer, my son passed away in an accident. He was only 4.5. And so, I know that feeling as a mother, to not have, the ability to be, with your children. And so, I think a lot of people who are incarcerated, they have a mother, right? And so they have a mother out there in the world who misses them. I can't say that, I can necessarily empathize or understand what it feels like to, have a son who's in prison, but I do know what it feels like to be separated. And, to think about, someone having the opportunity to do something which is life-saving, and to know that it increases the likelihood that you would be able to get home to your mother. Like, I feel like I wouldn't be doing, like a good job as a mother if I didn't, really urge you, like if it was something, that you to do, because it is that important to me. And I just want it. I want it for you.
To vaccinate, to social distance, to wear the masks, it's all about compassion for your fellow man and woman, period. I see people argue about wearing a mask and social distancing and vaccinations. And the fact of the matter is this: I don't want anybody to catch the virus that my wife and I had. I don't care that I survived it. I do not want my neighbor as deathly sick as I was. That is compassion. That is caring about the person. In an MDOC setting, that's about caring about the person next to you. That's about caring about the person in the cell next to you. It's the same as out here in the streets. It's about caring about your neighbor, your friend, or your family. Just because it might not affect you as bad as it might affect somebody else, you need to be thinking about that somebody else, because it can kill somebody, man. It's deadly.
As a woman of faith, faith does not eliminate me from needing to do my work. For those people that will trust their faith to get them through that, a part of that is correct. Your faith will get you through this. The additional part to that would be your faith and your works will get you through this. And that is getting the vaccine. The scripture says, faith without works is dead. And the scripture clearly tells us, if you're sick, the whole don't need a physician, but the sick do. Take your faith, allow that faith to work for you, put some legs to it, which is rolling up your sleeve, getting the injection, so that we can be examples to others in order to do the same thing. My whole household is getting vaccinated. A lady that I take care of has been vaccinated, but vaccination is important.
I will take the vaccine as soon as I'm able to do it. I was skeptical about the vaccine at first, but now I'm waiting in line to get it. I do not want to catch what we had again.
Don't wait. You need to get it as soon as possible. As soon as they offer it and they'll let you get it, go ahead and get vaccinated. We've already had over 40 million people in the US get doses of the vaccine. It's very safe, and it is already starting to have an effect on the way the virus is spreading inside the US.
And for correctional officers, I know what you're up against. But anytime you walk out that door and you come back in, whatever you're bringing it back in. So you need the vaccine as well in order to keep you safe, so that you're not being a carrier of the virus. So you need the vaccine as well as those that you are given the charge to oversee. So come on, let's do all the right thing. Let's all do the right thing. Let's get vaccinated.
The vaccine is one way to help make the situation of your incarceration easier. So it's a way to help keep yourself safe and more likely that you're going to get out and able to be with your family. Whether or not you have a relationship with your mother, whether your mother is deceased, like, there is someone on the outside who wants you back. And, the idea that, there's something that could be done to make it more likely, that you survive, your term of incarceration is, it means everything.
I'm Congressman Benny Thompson. I represent the 2nd Congressional District of Mississippi. I've taken both my shots. I have not had any problems. I encourage anyone who is considering to take a shot to do it. There's no other choice. The science at this point clearly reflects that it makes a difference. So if you're concerned about your health, even though you are incarcerated, I encourage you to take your shot as soon as it's offered. Let me assure you that there's only one vaccine. There's no vaccine for incarcerated people and another for people in the free world. One vaccine, we all take it, and those of us who've taken it, we've survived it, we feel better, and over time, we look forward to everyone getting vaccinated, including people who are in the Department of Correction, so that we all can take care of one another.
I'm Derek Johnson, President and CEO of the NAACP, and I want to encourage you to consider getting vaccinated. I have taken my vaccine, and you should consider the same. In the midst of this global pandemic, we must be safe. We must ensure that our communities are safe, that you are safe, but most importantly, our loved ones are safe. Consider getting vaccinated. It is really important for our health and your health.